All right, let's get right into it. If you're here, it probably means you're taking on one of the most loving and, let's be honest, one of the toughest roles out there, caring for an aging parent. And when orthopedic pain gets added to the mix, well, that's a whole different ballgame. So this is for you. Think of it as a little guide to help you find your footing on this journey. You know that look, don't you? That tiny little wince when they get up from a chair, the quiet sigh when they think you're not paying attention, and they always say, "Oh, I'm fine," because the last thing they want is to be a burden. But you can see it. You see the pain they're hiding, and it breaks your heart. That right there, that's the real challenge we're going to talk about today. How do we close that gap between what they're saying and what they're actually feeling? But before we even get into the practical how-to stuff for your parent, we need to take a minute and start with you. Because this whole thing, it's not just about their experience, it's about yours too. So let's just get this out in the open right now. That knot in your stomach, the late night worrying, that awful feeling of helplessness when you see them struggling, it is all so real. And it is completely valid. I promise you, millions of other sons and daughters are feeling these exact same things right now. You are absolutely not alone in this. Okay, so if you're going to be the best advocate for your parent, you've got to understand what you're up against. You have to understand the enemy, so to speak. So let's pull back the curtain and demystify what's actually going on with this kind of pain. So the first big idea we have to wrap our heads around is chronic pain. This is nothing like a sprain or a cut that just gets better. Chronic pain it's a marathon. It literally changes the nervous system, so the pain signal gets stuck in the on position, even if the original injury has healed. The pain itself actually becomes the condition. And this line just lays it out so clearly. Think about it. Acute pain is like your body's fire alarm. It's loud, it's annoying, but it's useful. It's telling you, hey, something's wrong. But chronic pain? That's like the fire alarm is broken, and it just will not shut off. It's blaring day in and day out for months, sometimes years. It's completely draining. And knowing this difference is key to really understanding what they're going through every single day. Now, a really common reason for this chronic pain is something called osteoarthritis. Here's a good way to think about it. Imagine the cartilage in our joints is like the tread on a car tire. After a lifetime of driving, that tread just naturally wears down. And when it gets too thin in our joints, you get bone grinding on bone. And that causes that deep ache, the stiffness, the swelling. So you see, it's not just getting old, it's a real physical, mechanical issue happening inside the joint. All right, so now we get what we're dealing with. It's time to arm you with the tools you need. This next part is all about practical, real-world strategies that you can start using to make a difference. Let's build your advocate's toolkit. And this right here, this is a huge mindset shift. You're not just a caregiver who helps out. You are their advocate. When you walk into that doctor's office, you're their second set of ears, you're their memory, you are their champion. Stepping into that role with confidence is so empowering, not just for you, but for them too. You know, great advocacy always starts before you even get to the appointment. Preparation is everything. So first up, document the pain. It can be super simple, just a little notebook. Pain is worse in the morning. Felt better after a warm bath. This is gold for a doctor. Second, make a list of every single medication, and I mean everything. Prescriptions, vitamins, supplements. This helps avoid bad interactions. And third, write down your questions beforehand. We've all been there. You leave the office and immediately remember what you forgot to ask. Don't let that happen. And hey, here's a little cheat sheet for you. These are the kinds of questions you should never feel bad about asking. You have a right to know. What is the exact diagnosis? What are all of our options? Not just another prescription. What are the side effects? And this one's my favorite. What can we do at home to help? This little list is your power tool. Use it. Okay, so the doctor's visit is important, but it's just one piece of this puzzle. The day-to-day management, the real work, that happens at home. So now let's talk about how to build a real plan for comfort. Now, take a look at this, because it really tells the whole story. Effective pain management is not just about pills. See, medication is just one slice of the pie. A really good plan also brings in physical therapy for movement, simple things you can do at home for comfort, and, this one's huge, support for their mental and emotional health. You've got to tackle it from all sides. And here's some of those simple things you can do at home.
Look, this isn't rocket science, right? But these little things add up. A warm compress on a stiff joint in the morning, a cold pack on a swollen knee after a walk, things like supportive shoes or a better pillow. These small actions are so powerful because they can provide immediate relief and, more importantly, they give your parent a little bit of control back in their fight against the pain. So we've spent all this time talking about your parent. And now, for this last, and I would argue most crucial part, we need to talk about you. Please, just let that one sink in for a second. It's that classic airplane analogy, right? You have to put your own oxygen mask on first before you can help anyone else. If you completely burn out, you can't be that strong, clear-headed advocate your parent needs you to be. Taking care of yourself isn't selfish. It's a non-negotiable part of being a good caregiver. And look, this isn't just some feel-good idea. The numbers back it up. A staggering 40% of family caregivers report high levels of emotional stress. 40%. That is almost 1 out of every 2 people in your shoes. This journey is hard. It takes a toll. And just admitting that is the first most important step. So I want to leave you with this. Not with a statement, but with a question. Just for you. Forget about some big, complicated self-care plan. Just think, what is one small thing you will do for yourself this week? Maybe it's a 20-minute walk by yourself. Maybe it's just sitting in the car listening to music for 10 minutes. A phone call to a friend. What is that one thing you will do to start refilling your own cup? Honestly, your answer to that question might be the most important thing you take away from all of this.